Hi, my name's Megan. I'll be your student nurse today. How are you?
I'm good.
All right, can you please identify your full name and date of birth?
It's Miss Bronchi at 73103.
Okay, thank you. I'm gonna go wash my hands and I'll be back.
Okay.
Provides patient privacy. Mrs. Bronchi, do you not mind silencing your phone while we talk about your medication? It shouldn't take more than 5 minutes, and it's important for you to know this. Okay. Thank you so much. All right, today we're here to talk about your methylprednisolone acetate, which is also known as Depo-Medrol. It's the injection you'll be giving yourself a week from today. Are you ready to learn about it?
Mm-hmm.
Also, do you have permission from your mother to be here? Because I know you're only 16.
Yeah.
Okay, awesome, thank you. Okay, so methylprednisolone works by decreasing inflammation and changing your body's immune response. The therapeutic outcome of this is that you've been having some exacerbated asthma recently because you've been diagnosed with mild asthma. Taking this will help decrease the amount of inflammation you have in your lungs, which should increase your comfortability breathing and decrease the amount of episodes that you have. But taking this inflammation increases your risk for infection. So my nursing diagnosis is that you have a risk for infection related to a suppressed inflammation response as manifested by taking the methylprednisolone acetate. Today, I'm going to have you identify some signs and symptoms of the process. You're going to describe some lifestyle changes and preventative measures, as well as repeat what not to do or eat while taking this medication. And long term, we will be identifying that you're having proper wound healing if applicable, be free of purulent drainage, and redness of your skin and fever. So basically all signs and symptoms of infection.
Okay.
So some signs and symptoms, pay attention because I'm asking you to repeat these, are if you have an allergic reaction, so itching, hives, swelling of your face, hands. If you have blurred vision because you're at risk of getting cataracts. So if you have eye pain changes in your vision. If you have any changes in how much you urinate, if you have an increased hunger or thirst, if you have dark urine or pale stools, nausea, vomiting, loss of appetite, or stomach pain, then you might have a peptic ulcer, which you're also at risk for. If you have a fast, slow pounding or an even heartbeat, then you might be tachycardic, and I know you have a mitral valve prolapse, so it's important to make sure that your heart stays healthy. And if you have any unusual bleeding or bruising, and if you have any mood swings, unusual thoughts or behavior, or changes in your body image, because this medication can put you at risk for some psych changes. And I know you're taking fluticasone, which is also known as Flonase, for your allergies, and because that's a steroid, that also puts you at risk for infections, so you need to watch and make sure you don't get any fungal infections in your nose, which is what that drug is known for. So do you not mind repeating 3 signs and symptoms back to me?
Bruising, rash, and mood swings.
Okay. But most importantly, so you need to watch out for all those things, but you need to watch out for infection.
Mm-hmm.
To manage some of these side effects, you're going to drink a lot of water, you'll avoid caffeine, you're going to cook all your food thoroughly, you'll wash your hands frequently, try to avoid being around people that are ill, do not take NSAIDs such as ibuprofen. Can you repeat some of those back? Things you will not do?
Don't take NSAIDs, avoid caffeine, and avoid people who are ill.
Perfect, thank you. And I recommend that you keep a journal while you are taking this medication. You'll monitor your blood pressure, your weight and height, as well as your respiratory rate, and how often you're short of breath, and how often you experience coughing fits,
Okay.
to make sure that the drug is working therapeutically for you. Do you understand your methylprednisolone acetate now? Okay. You'll also be giving this as a self-injection a week from today, so that will be November 22nd. I recommend you set a timer on your phone.
Okay.
Okay. I'll be giving you handouts describing how to give yourself this injection, and I'll be back in later to teach you how to do that. Okay. And then your Proventil, I am going to reteach you how to administer this. You get 2 puffs every 4 hours. 4 times a day, which is every 6 hours. To administer it, you have an aero chamber spacer. All you have to do is uncap your inhaler, place it into the chamber, uncap this, You'll breathe all the air out of your lungs. You'll perform a tight seal with your lips onto the air chamber. You'll release the medication, breathe in deeply for 3 to 5 seconds, hold your breath for 10 seconds, and then breathe out. And it's recommended that you rinse and spit with water after you ingest this. Okay. Do you understand how to use it? Can you repeat to me how often you can have it?
Every 6 hours.
Perfect, thank you. Do you have any questions?
No.
Okay, thank you. I'll be back into teacher injection.